This video will cover the internal anatomy of the human heart. First will be the right atrium, this chamber here that's open that the pointer is into. It collects blood from various vessels. That dark circle there is an opening to the coronary sinus, the veins that will return blood from all of the heart muscle. Also, this is another vessel, the inferior vena cava, that returns blood to the right atrium from all structures inferior to the heart. And up there is the superior vena cava that is returning blood to the right atrium from all structures superior to the heart, primarily the arms and head. From there, the blood is sent down through the tricuspid valve that the pointer is through into the right ventricle, this chamber here. The valve there will have these strands coming down from it called the cordae tendineae coming off of the tricuspid valve. The papillary muscles there attach to the cordae tendineae to keep tension on the heart valve to make sure it stays shut during blood pressures. That inner lining there, the light pink, is the endocardium that covers the inner surface of all the chambers in the heart. The darker red is the cardiac muscle, or the myocardium. Notice the thinner wall for the right ventricle. When the right ventricle contracts, it will then send blood upward toward that white structure there, the pulmonary semilunar valve, which controls blood leaving the right ventricle and going into pulmonary circulation. Blood goes out into the blue vessel there, the pulmonary trunk, as seen in a previous video. Then the blood returns to the left side of the heart into the left atrium through by pulmonary veins. Here are two of them, the left pulmonary veins coming from the left side of the lungs. The blood is then sent down into the left ventricle, this large chamber here, and that blood goes through the bicuspid valve there. As shown also are the cordae tendineae, the strands. Those strands are attached to that lump of muscle there called the papillary muscle. This keeps the tension on the cords and thus helps to keep the valves shut under high blood pressure. From there, or then separating the two ventricles, is this thicker interventricular septum. The blood from the left ventricle is then ejected outward through the aortic semilunar valve, that white structure there. Branches of the aorta, here's one of them, that is the left coronary artery, and then over there is the right coronary.